Cocahirelock, and many thanks for you all for joining us here today. I think it's fair to say HICWA have been before Oireachtas committees several times in recent years, and it's unfortunate it's the same issues that keep arising again and again. With that in mind, I might tease out some of your frameworks for measuring your performance, if that's okay. Just in relation to compliance notices, and do you have a figure on how many you've issued in recent years, and what is the rate of measured compliance afterwards? Like how do you measure that on each one?
So I'll ask Finbar and Susan to come in on the specifics, but just to say the legal compliance notices were used administratively. We required people to put compliance plans in place, but the legal basis for that has actually only been commenced since the end of February. So, but prior to that, in the absence of having a legal lever, we actually issued at the end of every inspection a compliance plan and an improvement requirement. But maybe Finbar or Susan might want to come in on the specifics.
Yeah, I might just make a distinction between a compliance plan and a compliance notice. A compliance plan, we have always required providers to respond to areas of non-compliance, and we publish our compliance levels in our annual reports each year. But a compliance notice is a new power that has been just given to us, and we're in the process of implementing that. We had an administrative process, and I mentioned when I was responding to Deputy Arda, we have an administrative process where we require a provider to take immediate action or urgent action.
How do you measure what action the provider is taking, I suppose, is what I'm trying to get at. How do you set the bar, and how do you measure that they are meeting the bar?
So in relation to immediate or urgent action, we require the provider to demonstrate immediate action, and we don't, either we won't leave the centre, or within a few days we require evidence that it has been taken. In regard to compliance plans, providers set out how they're going to address compliance plans after the inspection. We then review those on the next inspection to confirm whether they have been implemented or not.
Okay, thank you for that. And in relation to closures, I think my colleague Deputy Bennett asked this question earlier on, and you outlined some figures: 2 in 2020, 3 in 2021, 1 in 2022, 3 in 2023. 10 notices issued in 24, but 7 closed, and 1 closure in 2025 to date. So that's 17 closures in 5 years. Am I right on that? Are any of them 17 of the same operator?
In most cases, I might hand to Susan, who'll have the specific information on those.
In the closures that would have happened from late 2023 to early 2025, there is a common trend, not in the named provider, because each were operated by, the majority of them were operated by individual companies. A significant number of them set under the umbrella group known as the Apuri Group. There was another 2 centres that were owned and operated by the same provider that were they had their registration cancelled. And then the remaining 2 were owned and operated by different registered providers comprised of the same directors.
Okay, so there is, within that common thread, is there additional monitoring taken by HICWA then to specifically look at those that fall under that common thread umbrella?
Yes.
And any other centres that they may operate that haven't gone as far as closures?
Yeah. We have a system to share the learning from individual inspections. We don't go out expecting to see that because one thing is happening in one nursing home, it's happening in another, but we're awake to the possibility that it may be. And we have a process through our regional management structure to share learning from inspections of different nursing homes. And it may not just be, private providers, it could be the statutory provider, or it could just be a trend in the sector. And we have processes for sharing that information internally.
That's very positive that you've identified that and you're aware of that, and I'm really, really pleased to hear that you're working on that. Just in relation to the MES managed properties, there was a bit of conflicting information there. It was said on 2 occasions that 25 there's 25 of these in operation, but one said 16 have been inspected since the RTE programme, and Susan, you mentioned 22.
22 as of yesterday evening. So when the data was pulled initially, it was 16, but there was a further number of inspections completed yesterday evening. So as of yesterday evening, that number is now 22.
Okay, and only one of them has had to be inspected a second time?
Only one of them has been inspected a second time so far.
Okay, and how many times does something have to be inspected before action is red flagged, should I say, or that it elevates to the next level of concern?
Depends on the issue that's identified.
Okay.
So, and that's all grounded in our assessment of the risk to individual residents in the centre. So if we're really not satisfied, and if it's a repeat finding over repeat inspections, you know, we will afford providers an opportunity to address issues are identified, and expect that they will do it, because the vast majority of the sector will. But if we go out and it hasn't been addressed, well then obviously we have an increasing concern, and the time frame to make the changes will be shorter. And we will then move into our escalating regulatory action. We'll have enforcement action in the form of conditions, and that will bring a shorter window. Like I said, one centre last year was inspected 9 times. That is very unusual, and it's really important that we recognise the vast majority of the sector take action on foot of the findings of inspection and are starting the work as the inspectors are going out the doors.
Okay. And in relation to the inspectors inspecting the properties, I understand it was mentioned earlier that each inspector has a caseload. Is the caseload rotated, or is it the same inspectors? So the same inspectors aren't inspecting the same properties?
We have a process of changing over about 25% of centres per inspector per year.
Okay.
So we try and avoid that situation, both for the inspector and for the registered provider, because if you're going in the door, you stop seeing the same things. But equally, the growth in the size of the team over the last 3 years on foot of the expert panel review meant we went from 4 to 5 to 6 regions, and that necessitated casehold changings as well. So all of that contributed to the changes.
No problem. If I may, I'm just going to draw attention to HICWA's vision, strategic mission and values, and the first line of that states that you will work to promote human rights, as well as identifying, challenging and reporting on breaches of rights in health and social care services. I suppose given the recent revelations in the RTE programme, does HICWA still stand over that vision? And I know that's a very hard question to put to you, but it's something people are asking.
I think it's a fair question, Deputy. I think it actually underlines the importance of reinforcing that is our mission. I think certainly my predecessor, and from the start, the inception of HICWA, one of the things we have driven is that focus on human rights, because it is important to say that regulation provides kind of a minimum compliance. What we've tried to do is move people towards a system where they're doing it because it's the right thing to do, rather than because we're inspecting. And I think that's an important point to make, that if the system of delivery of care becomes dependent on an inspector coming in and shining a light, well then we will always have people doing things because somebody else is telling them to do it. What we're trying to do is get the system to do it because it's the right thing to do. And I would have to say that in the time that I've been here, I've been at many provider events, many events which mark particular landmarks. And what I've been struck by is the commitment of the vast majority of providers to deliver good care. But I think it's a fair challenge to put to us. I think we have been challenged by the events, and we do have to make sure that continues to be amplified by the work we do, by the training we do, by the e-learning events, by the learning events we promote with our own staff. We do a reflective practice event every year with all of the regulatory team where we go off-site and we challenge ourselves to look at where we could do better. We also do that with the provider system. I was at an event recently where all of the providers there, and many of those would have had challenges with us, but I think we've moved to there's always been a tension, can you be collaborative as a regulator? And we believe you can. But I do think it's a fair question you've put to us, and I think it amplifies the importance for us to do the learning we're looking at for ourselves.
Appreciate that. And if I may, do you feel you've lost the trust of the public, particularly since the airing of the
I think people
documentary?
will feel that there's a dent in the armour in terms of we were the trusted voice. We'd like to believe that our track record in terms of shifting the dial, in terms of amplifying particularly restrictive practices in disability and moving people out of congregated settings. That was the work of the HSE, but championed by us. I think the work we've done in older persons, where we really amplified the voice of the resident and really tried to put the emphasis on what it's like to live here as opposed to a task-based approach. I think we've been strong, but I think we are challenged to do better, and I think that's the commitment we've made. That's not just about us. A lot of the discussion here is, have you got the levers you need? I think that is part of it, because those levers, you might never use them, but they do act as a deterrent. They do act as a barometer for performance.
Sorry, I'm out of time. Thanks very much.
Thanks,
Thank
John.
you.